Good morning. It's a Wednesday, the 9th of July. Thank you so much for joining us here on Eswatini TV, Kusile Breakfast Show to kickstart your day. My name is Fisong Malo, and I'm with Lungelele Makakula, hoping that we're going to all have a great start to the day and eventually a productive and good day. But again, good morning. Lulu, good morning. How are you?
Good morning, Guni. I'm well.
Doing fantastic.
I'm great.
I'm all right.
Yeah, and good morning to our viewers as well. Thank you for tuning in. This is the Wednesday edition of Kusile Breakfast Show. As always, Prudence Mnisi. Center for Financial Inclusion. We want to have a discussion on how to manage or improve your financial health. We are halfway through the year, and some of us made commitments. Will save how much invest kuphi sisave imali lenganani budget because simo semnotho sigabi kakhulu sifuna ukukhulumisana naye Prudence kuva ukuthi see how do we save, how do we budget, how do we invest, where do we invest our money, how do we improve our financial situations. At 7:30, what advice do they have for consumers? And also, the first episode of Asibambane Sibe Ngumdeni is tonight on Eswatini TV at 9 p.m. Namzamo Dlamini, who is the gender coordinator at the DPM's office, Stabasnaye via Zoom today. What can you anticipate on the first episode? Was the show able to fulfill its purpose? Stavagabandi Ngaye later today. Stay tuned.
6:30, we are having a conversation around the well-known cracks under the Ministry of Health, or rather, let's say the health sector of the Kingdom of Eswatini, and we're having that conversation with a doctor, Dr. Advocate Dlamini, the Chief Executive of Kusile Clinic, and we are looking beyond the stethoscope as we try to prescribe solutions for the deepest challenges that the health sector continues to face. Of course, we know the famous one, under-resourced facilities. We know the frequent medicine shortages, which has been a thorn for a very long time now. And of course, the ever-widening gap between policy promises as well as patient experience, another thorny one, as well as, some of the concerns around some of our health practitioners going to look for greener pastures in countries outside of Eswatini, particularly the United Kingdom. I mean, it's good for them, but is it good for the sector, its appetite, as well as for, our health graduates and practitioners, those who are still in school? What do their futures look like? Are their aspirations still feasible? So we look at all those issues, but most importantly, we try to prescribe the solutions to these problems, and perhaps going forward, as the whole country hopes and wishes, this becomes a conversation of yesterday, and we move on with a brighter future, because indeed we want our patients, we want Eswatini to be healthy. So that's it. That is our conversation this morning, coming right up at 6:30 a.m. on Eswatini TV, Kusile Breakfast Show.
Yeah, stay with us. It's 3 minutes after 6. We go for an ad break. Nasbuya Satatin Zabati Eswatini.
Fumanas asashonema kude lo dawati kuthula la ngamanyaka cha ngiyaqolisa mle no ngeke phela lokuleza ngokubalekela ukuthi singumndeni simunye sivale kwazana sonke yini lamanyana lawa wena uyaphila kahle la angeke uyimele lempilo ufuna kuyisusa utawushaka kabuhlungu.
What the hell is going on? Don't touch me. What is she doing here?
Angicabanga sinecabanga sisile le ndole. Angesabi impi before. I need to talk. Sorry. Man, kukhula sitaqina sibonela sejubenya.
Hi, sweetie. Unjani?
test.
Asimze sinamukele ngo-5 minutes after 6 Nadidi Nzaba. Umhlonishwa Ndvunankhulu Russell Dlamini uthi inhlangano ye-World Vision solo iyachubeka nokubambisa uhulumende etinhlelweni ledifaka ekhathi ukufakwa kwemandi lahlandekile emimangweni. Umhlonishwa Ndvunankhulu uthi le nhlangano itawusukumisa umsebenzi wemandi lahlandekile latawuzuza emakhaya langu-200 enzaweni yaseThuthukani emhlangatane kuleli viki. Ndvunankhulu uvete lokhu ngesikhathi loyo lebeka ngumphathi wale nhlangano kuleli Thina Mukunda avalelisa kuNdvunankhulu njengoba kubheke ukuthi ahambe kuleli lenyanga letako.
Umhlonishwa Ndvunankhulu Russell Dlamini uhlangene naloyo longumphathi wenhlangano i-World Vision Eswatini lokubheke ukuthi aphume ehhovisi kulenyanga letako Thina Mukunda. Ndvunankhulu uthi-ke Mukunda ubike tindzaba letimnanzi letifaka ekhatsi umsebenzi lotawusukumiswa ngalokusemtsetfweni ngalesine kuleli viki endzaweni yakaHhohho lapho kutawusukumiswa umsebenzi wemandi lotawuzuza emakhaya langu-200. Ndvunankhulu uthi uphindze wachazelwa nangembono wale nhlangano wekufinyelela kubantfu labangu-329,000 eminyakeni lesihlanu. Loku-ke kwente kutsi uhulumende akuthakasele kakhulu njengoba lo mbono utawuphindze uqinise kakhulu nasetindzabeni tekuvikeleka kwebantfwana nemalungelo abo kanjalo-ke nekulwa nekuhlukubeteka kwabo bantfwana. Ndvunankhulu uthi uhulumende sewubheke ukuthi kahlangane nemphathi lotawuthatha ematomu kuMukunda lokutawuba ngu-Amos Zayende. Kubika Sondomlangeni, titfombe titfolakale ekhasini letekuchumana lahulumende.
Luyaqala lamhlalo uhlelo loluthi asibambane sibe ngumndeni ngensimbi esiphohlongo kusihlwa emsakatweni wetitfombe Eswatini TV. Liphini laNdvunankhulu umhlonishwa wathu lidladla selikhuthate eMaswati ukuthi alubukele lolu hlelo njengoba lutawudlala inzima lenkulu kubuyisa imindeni. Lolu hlelo lukhicitwe ngumsakato wetitfombe Eswatini TV ngekubambisana nelihhovisi leliphini laNdvunankhulu kanye nelihhovisi lalonxusele le-Taiwan kuleli.
Cela kusho ukuthi uma unasigujana wakho ekhaya ngalesithathu lo wakusasa mhla ka9 nga8 uma shuthi ulala nga7:30 hlala ke uthi ngoba nga8 kungena luhlelo lelo phakanyiswe ngiyo ingwenyama yeMaswati ise-Parliament yathi lihhovisi la DPM hulumende through lihhovisi la DPM akafune bonke labalahla abantwana akafune bonke labalahla abadala siuhlanganisa umndeni ngoba phela lapho kuneluthando khona kunekuthula lapho kunekuthula khona unani kunempumelelo bese bantfu live seliyanotha ngoba kusuka nakuya kulolathando nalesizukulwane lesisikhulisako sikhula sineluthando ngakho ke sitawufunza kube nekuthula eveni live liphumelele kepha uma lungekho lothando sitawulahla abantwana silahle abatali manje ukhaze bahlala abanyukubele lo mntu akasimnanzi ngekhathi ngekuthi uthi mina emaka ngimati mina baba ngimati sengakhuliswa ngugogo nagogo uyakhala uthi mina abantu abami bangilahla bangijijela ngalabantwana umuntu lomdzala ke uyahlupha uma sakhulile ngoba uyakucalekisa.
Njalo ngeminyaka eveni leSwatini kuphothula inshale ngetulo kwa 25,000 kodwa ke labakhona ukuthola imisebenzi balinganiselwa ku-1,000 kuphela. Lokho kusho ukuthi itinkulungwane temaswati tisala tingenato tindlela tekutiphilisa. Umhlonishwa Phila Buthelezi indvuna yelitiko letisebenti nenhlalakahle yato lophindze wakhuluma esigabeni sendvuna yetemasiko netindzaba tensha uvetile ukuthi kungatfolakali kwemisebenzi kunemthelela lomubi etindzabeni tekwenyuka kwelizinga lebugebengu kanye nekusebentizwa kwetidzakamidzwa. Buthelezi ukusho lokhu ku-Out of School Career Expo lebekadze ibanjelwe eKhilani eSpiki ngalesibili.
Indvuna yelitiko letisebenti nenhlalakahle umhlonishwa Phila Buthelezi lophindze wahamba emagameni endvuna yetemasiko uvetile kutsi sekusikhatsi ukuthi uhulumende ayibukete kabusha indzaba yokweswelakala kwemisebenzi eveni.
Unemployment doesn't hurt your wallet, but it strikes at your sense of identity. It isolates, it erodes confidence. It pushes far too many of our youth towards dangerous coping paths such as substance abuse, crime, and hopelessness.
Buthelezi uchube kwaveta kutsi kufukulwa kwabantu labasha eveni akugcini kukhuphula umnotfo kuphela kodwa-ke kucinisekisa intuthuko lekonsako kantsi-ke lilunga lephalamende SP kumhlonishwa Jabulani Mabuza kutsate yona insha kutsi itimisele kokonke lekwendako ingavumi kwehluleka.
Ulwele kutsi yonke into uNkulunkulu layiplante empilweni yami lengekho kulabanye ibe yimpumelelo. Nalo kutsi-ke uphindze futhi umuntu lomusha ungancineki ube confident to yourself.
Dr. Glory Dlamini lisekela lameya eSpiki utsi sekusikhatsi sekuthi kubanjiswane kulweni nekweswelakala kwemisebenzi eveni.
Investing in the youth through provision of robust career guidance and counseling is crucial in addressing the challenges highlighted by the Eswatini National Skills Audit Report.
Umphathi wenhlangano yabantu labasha eveni Lwazimamba uthi insha ayikukhuthalele umsebenzi wetandla.
Ngabantu bakhuthata nje abantu labasha ukuthi siyadzinga vele lokushintsha lendlela lesibuka ngayo sathi ukuthi tandla tethu nemandla ethu umnotho wethu.
Insha nayo ke ibe seyifaka imibono mayelana nalomkhankaso ukufaka ikhathi lokho leseyivuleke emehlo kuko.
Bona ngathi kusita ukuthi kubona ukuthi kunemathuba lamaningi la
organize ama-event awangifundela okuningi ukuthi singahamba sifune imali kuphi siqongothe kuphi singene nakuphi people abangadathi abantu abanye ngikwazi ukuthi ngaqhubeka yendekele nto le nalabanye indzawo ingagcina sibiki phela.
Imibiko ikhomba ukuthi liphasi lizinga lebantu labasha labacecesheke ngakutemakhono eveni lokuyinkhomba ukuthi kuhlanyela ngakulolu hlangothi kungalehlisa lizinga lekweswelakala kwemisebenzi eveni. Umbiko nguThabiso Maphanga eSpiki.
Imvona yelitiko letekuvakasha netindzaba temvelo umhlonishwa James Melane seyisukumise umkhankaso lohlose kusita abamfu labanelibala ngetimvo labatitsingako letfaka ekhatsi emafutsa ekugcobisa lenta ukuthi imisebe yelilanga ingalimati sikhumba. Imvona yisukumise lo mkhankaso ngesikhatsi yetfula letimvo kulabanye bafundzi labanelibala.
Bantfu labanelibala bakhinyebeteka kakhulu nangabe baselangeni ngoba lemisebe yelilanga ihlaba ngco esikhumbeni iphindze endlulele. Bantfu labanelibala lapha eveni abakhona ukutfola emafutha ekuvikela sikhumba ngendlela lebhekekile. Libandla lelibuke imvelo selinikelele bantfu labanelibala ikakhulu bafundzi nebantfwana ngetinfo labatitsingako. Yetfula letinfo indvuna yelitiko letekuvakasha nendzaba temvelo umhlonishwa James Melane itsike lokusita kulesimo kuphindze kube indlela yekufundzisa ikakhulu ngetivumelwano letfaka ekhatsi i-Montreal Protocol.
Labantfwana labanelibala kuhanjwe onke lama regions lang-4 letifundza letine sifuna labantfwana. Lokusho kokuthi ayigcini lapha namuhla nasisuka la siyahamba siya ku onke lama regions lamane letifundza letine sinika labantfwana labanelibala letinfo letisitotilonja lapha namuhla kokuthi nabo bavikeleke.
Emukela letipho umsunguli wenhlangano iStucky Foundation Imphunga Stucky Motha ithi lolusito litawuhamba umgamu lomutse.
Lilanga sitha lesikhulu sebantfu labanelibala. Siyabonga kakhulu ukuthi Environmental Authority asendele naku lasiphakona.
Siyabonga naloko ukuthi kune partnership iyaqala namuhla. Siyathemba ukuthi itawuqhubeka size sikhone kufika kuleli goal lokuthi kude loselele ngaphandle.
Pinki Sithole lomelele umphathi wenhlangano yakamhlaba lebukete entuthuko uthi le nhlangano itimisele ukuthi iqhubeke nekubalihlahlandlela ekusiteni bantfu labanelibala lapha eveni. Sithole uthi lesivumelwano seMontreal asigcini ngekuteka tindzaba letiphatselene netindzaba telidvadvasi, kepha-ke uthi siyagabdzela size sifake nenzima letsite etindzabeni tekuthi kuvikeleke bantfu ikakhulu labanelibala kulomsebe welilanga. Lakangwane njengoba litibophelele ngekusayina sivumelwano lesinciphisa nekucedza loko lokubanga kulimala kwelidvadvasi ozone layer ngesivumelwano seMontreal Protocol, lapho-ke live selihambe umgamu lobonakalako kucedza kusebenziswa kwaletintfo letikhipha intfutfu lelimata lolidvadvasi. Kubika Sondo Mlangeni, eMbabane.
Lekomiti lelibuke kusebenta kwelihhovisi leliphini landvunankhulu endlini yetimphunga selithatha imibono yesive ekwakheni umtsetfo losakhankanywa wekusebenta tindzaba tetehlakalo eveni Disaster Risk Management Bill 2024. Lelikomiti belihlangene netinhlangosi letehlukene lebetenta tincomo tekucola lomtsetfo kute utolisebentela kahle live.
Lobekabambe kuba ngosihlalo waleli komiti imphunga Sicelo Dlamini uchaza ngebumcoka balomhlangano netinhlangothi letihlukene njengoba lo mthetho waqala ukukhankanywa ngeminyaka wa 2024.
Kunebhili lesinayo yaka DPM sekunemalanga noko siyicalile sebasiworkshophile ngayo ukuthi itawusebenza kanjani. Kafisha nje bezama lokuthi national disaster azame lokutimela angazi isikhathi esiningi ukhanze ukuthi kusebenza kwakhe kuba fast manje lokuthi abo so ulandzela uhulumende kakhulu tonke into le process yahulumende iye ibe yinze kani i-disaster yokhanza iyendeka namhla kusasa kufuneka i-action.
Lo mthetho uqukethe izihloko letifaka ekhathi kubekwa kwelibandla lelibuke tehlakalo eveni kuvikela tona tehlakalo kanye nekumikisa lusito loludzingekile naloluphelele esiveni. Letinye tinhlangosi letihlukene letibe nelithuba lekufaka imibono yato kulomthetho tikhulume ngetindzaba letinyenti letifaka ekhathi bumcoka bekuthi imithetho yetehlakalo netekugucuka kwesimo selitulu itsetane nekunakekelwa kahle kwesive ngesikhathi setehlakalo.
Kunekudla lekungenako eveni kuchamuka kulamanye emave. Kunetintfo lesitikhicita kangwane lesititsengisako sitidliwe ngemaswati. Singiswasa sinemsebenti wekuthi sifake luphawu lolushoko ukuthi lo mkhicito lo uhloliwe bantfu bemazinga wakhanzakala ukuthi uyawalandzela emazinga.
Amendments that the DRM plan shall include guidelines for community-led recovery, infrastructure rebuilding.
Uthi kumele kube nemigomo lecacile ukuthi uma takhiwo tilimele tibuyiselwa kanjani esimeni sato, kuphindze futhi kube neluhlelo lolucacako ukuthi bantfu bona basitakala njani ngetemphilo kanye nesimo sabo sengcondvo ngemuva kwekuba setehlakalweni.
Kunetindlela emaswati latingathi ukuthi lesijele lesathela kangaka ungathi kutasomiswa nakunje kudinga indlela lebasebenzisako. Ngizama ukuthi ngiyakuthatha kakhulu lokho ukuthi sibusebenzise vele sikugcizelele kakhulu ukufaka le-indigenous knowledge.
Imphunga Sicelo Dlamini ichubeke yachaza ukuthi isigaba lesilandzelako nguleso sekwethula lo mthetho losakhankanywa endlini yetimphunga kubukwe netincomo tendlu yabayesikhulu ngaphambi kwekube indlu yetimphunga iwuphasise. Kubika Mbonga Dube Kalobamba.
Libandla lelibuke emagugu elive ngaphansi kwemsebenzi wabo Mbuluzi Ecosystems Restoration Project sebacola imikhombandlela lemibili lebukete kuchumana kuletinkundla letingaphansi kwalomsebenzi kanye nekunganyukubeteki kwemvelo nakusasenjetwa. Umphathi walelibandla Thulani Methula uthi kumcoka kuthina kunentuthuko noma lushintsho emangweni kuhambe embili kuhambisa lwati kanye nekugcina imvelo ihlantekile.
Kulomsebenzi kubambisene libandla lelilondvolote emagugu elive i-Global Environment Facility kanye ne-United Nations Environment Programme. Umphathi waleli bandla Thulani Methula uthi inhloso yalomsebenzi kulungisa tinkinga letibhekene nemfula imbuluzi River Basin kanti lo mfula ungulomunye wemifula lemcoka eveni uphinze uzuze lamanye emave lafaka ikhathi iMozambique.
The communication strategy kubuka ukuthi bantu labasebenta kulendzawo yembuluzi ecosystem ngoba le project yethu igama layo imbuluzi ecosystem restoration project. Lokubuka lo abantu labaphila lapha kule mbuluzi ecosystem bangasebenzisana kanjani lesithi stakeholder collaboration. Siphinze sibuke ukuthi ezibasebenzisana bangakhulumisana kanjani lesithi communication amongst stakeholders. Le document yesibili lesibukako i-integrated land management strategy. Leyo ibuke ukuthi njengalokwati ukuthi yonke into lefaka imvelo yenteka emhlabathini on land. So nayenteka on land kufanele sibe nendlela yokubuka ukuthi lo mhlaba siwusebenzisa kanjani ngendlela lekhosile lesithi ngesingisi in a sustainable way. So the integrated land management strategy yethu itasita kuloko kubuka ukuthi how can we come up with livelihood programs.
Lobuke lo msebenzi Thobile Dlamini uthi lo msebenzi ubuke kwakha tinhlelo letitawulekelela kuvikela imvelo.
Kule mimango le lesebenta khona la sakhe khona nalama CDP bakhona ukuthi bende ngalokuhlukile ngentuthuko lekhonsako sifise lokuthi isiphela iproject sibe senda ngalokwehlukile sibe futhi senda ngekwati senda sifundisekile.
Mapalane jikelele wenhlangano yemhlaba yemfundvo temasiko nescience lapha eSwatini UNESCO Lwandle Simelane ubonga kuba ingcenye yalo msebenzi.
Firstly, it speaks to climate action. And kangusi kulamalanga ngiyo indzaba lesiyibhekako ikakhulu nje nibonile ka UNESCO besilonja i-Green Standard yona ke sifundisa abamfana nensha ukuthi inakekele imvelo. So ENTC is such a great stakeholder and this is a commendable project.
Lo msebenzi ubita 3.8 million wemadola asemelika kanti ubheke ukuthi uphele ngeminyaka wa 2027. Lobikako nguSethabile Mamba, Nompendulo Shabalala, Bongani Masuku, Zulwini.
Tigebengu kusolwa ukuthi betihlome ngesibhamu ticekeze isitolo lesithengisa tshwala eMseni Bottle Store eMathendele. Ngekusho kwalosebenta kulesitolo lihle gameze letigebengu tebe imali lelinganiselwa ngetulu kwa 9,000 emalangeni kanye netinhlobo letahlukene temabhodlela etshwala.
Ngikusho kwalosebenta kulesitolo sasemseni lihle gameze lokucekezwa kwalesitolo kwendeke ngekuso kangemsombuluko sekushaya insimbi yesithathu ekuseni. Gameze uthi abenalomunye umlingani wakhe bathena beva ukuthi kuyacekezwa babaleka ekamelweni bobhaca isitolo satshwala lesakhelene nalendlu labalala kuyo.
Sizina sisehlele nalomunye umfana lesibohle sibamba naye. Sive umsindo okhala kwelithayela la khashanyana but ngathi se store room. Khashanyana nale room lesilelekiyo. Okay, sibuta okay ngimvuze ngimthinze because basefonini yena basakhuluma nje akhulumela nefoni. Ngimthinze ngithi over nomsindo okhala wamathayela emnetho. Athena hayi dipoko. Phinze ngive kuhle. Ngithi mina phela kude dipoko wakova kuthina sipoko. Sithi nasisuka masiphume ekamerweni silandzelana la passage. Sive lokuthi lelithayela vele seligwabukile kahle sebashaya leliplango noma isilingi. Because inesilingi la store labe bangena khona. Asithi nasilandzelana nemnetho sibone ukuthi hayi khona longenako kenyalo because besova ihlika lomhlabathi loba la kulesilingi. Ngiphuthume mina ngicishe lamalamba ngise emalambo kuDP because bekhanya all over la makamera. Nangicisha vele already munye wabo basangenile ngekhathi because ngathi bangena baze baba yi3 nasho ukuthi bangene bacingela bacingako bathathe khona imali beyikhona besebaleni singalinganisela bo 9 point something labayithulula nje labayithatha sebaleni kodwa umnetho wakhona ngene emkhathini wama-fridge wabhaca khona nabafika bathathe shothi na because bebakondela emahleni akhe beka lama-fridge nje phakathi kwalama-fridge amkhathini ngalokuthi ke bekumnyama bengakhona ukumbona ngabe bebakhanyise nganibona because nakasho yena uthi khona bebakuphethe lokusasibhamu lesikhulu and lo munye bekakhuluma akhuluma sakuzunda athi nayivela le ndoda niyibulale nidubo like azunda nje like khuluma kwakhe athi nakavela sibani okay bangalisho igama but nakavela nemdubule nembulale.
Kametse uchubeka watsina tiphuma tibaleka letigebengu tikhohle sikhwama lebesilayishe tishumba temitsi yesintfu lucingo emafutsa ekugcobisa kanye nemateke lakhoste lokubese kutsatfwa ngemaphoyisa lokuchumanisa emaphoyisa nesive ephindile vilakati uvumile lombiko wegcekezwa kwalesitolo waveta kutsi emaphoyisa achubeka neliphenyo kutfola letigilamkhuba kubika Thando Kuhle Mdluli Mathendele.
Libhangele elikhulu kuleli i-Central Bank of Eswatini selethule imali lensha lecala kusebenta kuleli viki. Le mali yemaphepha lengu-10 emalangeni na-20 emalangeni lensha inetingucuko kunaleyo ledayelekile lokufaka ekhatsi libito lelive Eswatini lelaguculwa ngeminyaka wa 2018. Lisekela lemcondzisi welihlangothi lelibuke imali netekubhanga ebhange lelikhulu Zodwa Nkambule uyachaza ngale mali.
Libhange lesive likhicita imali ngekubuka idemand leqhamuka kuyo ipublic so lena nje itongeda because imali ezinibona ihlobile kusho ukuthi imali ezingcola iyashredeka iyadestroyeka bese sirelease lenye and as i-economy ikhula idemand bakhona u release new banknotes lokuchinjile kakhulu kube ngegama lelisha lesive Eswatini from Swaziland phindze sesifake Siswati nawubuka ngemva kwebanknote sekunemtsholi wemaswati kuphindze kuba na Central Bank of Eswatini phindze nalala lishumi emalangeni ku10 emalangeni so phindze ne-signature ya governor wethu lomusha Dr. Phil Mnisi nayo ngiyo lechinjile lama security features are strong ngitawubekisa nje ngalo 10 emalangeni nalo 20 emalangeni sesinana lokubathi security threat lokwetfunyalo i-security threat yethu seyine rolling star effect iyachinja lombala to greenish as uyitilta uyihambisa so ngiko lokunye lesichinjile nje kulena lensha so the security features aseswatini ngola sitako kuthi le counterfeiting ibe sezilingeni lelincane.
Bafundzile ababili sebabuyile kuleli ngemuva kokuphothula tifundvo tabo tephoyisa eveni leGibhithe ngaphansi kwehlelo lwe-African Police Cadet. Ngekusho komphathi wamaphoyisa Vusima noma Masango lokubambisana nalelive kunemthelela lemihle eveni ngoba sekutawuthelelwana lwati netindlela letijulile tekubuka bucala.
Lolu hlelo luyingcenye yesivumelwano sekusebenzisana emkhatsini weGibhithe neleswatini. Umphathi wemaphoyisa Vusima noma Masango ukhutsate labafunzi ukuthi bashiyelane lugwayi nalamanye emaphoyisa.
Njengoba sesithathe idecision ukuthi nitawahamba niyo-appearisha before the training board yamaphoyiseni mbali nifene ne-presentation niyi-convince ukuthi indeed kukhona i-change lentanayo zibangabona kukucola ukuthi lokho kunga-implement i-police organization still to
Labafunzi babese bayatibongela baveta nalabakufundzile kule minyaka bahambile.
Ngicabanga ukuthi ke kungaba mgcoka ukuthi nathi sibuye sibabonge bonke for leli thuba labasinike lona. Sibonge bonke labasite ngako ema-funds ngako konke. Sicele ke ukuthi sibe khona nathi sitimisele nekusita lelive.
Sifikile ke sathatha lwati njengabo forensics njengabo criminal investigation njengama communication skills siyathemba ukuthi lelwati lesiqhamuka nalo eGibhithe litayenda tawufaka emandla kule organization lesikuyo.
Lolu hlelo luvumela ukuthi njalo emva kweminyaka lemibili kube nemaswati lalibhekisa eGibhithe kuyofundzela idiploma in police science. Lobikako nguSethabile Mamba. Kanti tithombe titfolakale ehlangothini letekuchumana eSwatini Royal Police Service.
Umsolo walabathathu babekwe licala lekweba intsambo yagesi lebita imali letingulungwane letingemashumi lamabili 20,000 emalangeni esiteshini semagesi eHluthi. Laba umsolo bavele enkantolo yamantshi yenhlangano.
Bomsolo labathathu lokubo Andile Ndwando leneminyaka lengemashumi lamabili nakutsatfu, Abraham Mabuza leneminyaka lengemashumi lamabili nesithupha, kanye naMvuselelo Matsenjwa leneminyaka lengemashumi lamabili nakune, bavele embekwe enkantolo yamantshi yenhlangano babekwa licala lekweba Ngutsala bomsola ngalokungekho emthethweni nangenhloso bantshontshe underground cable lengumbala lomnyama nalokubomvu lebita imali letinkulungwane letingamashumi emalangeni. Ngutsala bomsola bendele licala estation samagesi endzabeni yaseHluthi mhla 13 kule nyanga lesetulu yaKholwane. Ecaleni lesibili umsola wesibili ubekwe licala likushaya ngenhloso ekulimata. Ngutsala umsola ugwaza isimangalo ngesilimato lesikhaliphile emahlandla inhloko ngekusho kwamaphepha senkantolo lomsola wendele licala mhla lulunye kule nyanga lesetulu yaKholwane. Inkantolo ibese ithila bomsola batawugcinwa ngumnyango wekulungisa timilo nekucondzisa tigwegwe kude kube nginati-10 kule nyanga yaKholwane lapho batawubese bayabuya enkantolo kutochubeka nekuteka lelicala. Kubika Thando Kuhle Mdluli, Inhlangano.
Imidlalo ye-Region 5 Youth Games itolo ingene elangeni lesine. Domsani Ntiwane lokhulumela inhlangano leyengamele inhlangano tetemidlalo kuleli uthi selikhona lithemba ukuthi ilive litawuthola imindlela letinyenti kule midlalo lefaka ekhatsi emadubane kanye nesibhakela. Anti letinye inhlangano leyengamele ibhola kuleli ngekubambisana nenhlangano leyengamele ibhola emhlabeni bachubeka nemhlangano skolo abonompembe labasebancane ema-FIFA Youth Referees. Lo mhlangano skolo uchubeka e-Technical Center Kalobamba. Kanti kuletinye abalandzeli bebhola yetinyawo bathi kubabede kwamalambo eKing Sobhuza Stadium kuyabalimata ngoba leminye imidlalo ledlala imini abakhona kuyibukela kanti kube emalambo akhona ngabe bayakhona kuyibukela nemidlalo yasebusuku. Labalandzeli bathi bacela ukuthi labaphethe ibhola eshiselweni batende taba ukuthi lokungenani kusizini etako afakwe emalambo kulenkundla. Satiphetsa ngeleto temidlalo 28 minutes before 7 sasalkhefu sibuya sikhulumisana na Dr. Advocate.
Eswatini TV has signed a code of conduct that is enforced by the Eswatini Communications Commission. We are committed to reporting news that is accurate, comment that is fair, and programming that does not amount to hate speech or the description of gratuitous violence or explicit sex. For any complaints of our programming, please contact us on 2411-9600 or email info@eswatinitv.co.za. You can also contact the Eswatini Communications Commission on 2406-7000 or write a letter to ECCOM on PO Box 7811 Mbabane. Email address is info@ecom.org.sz.
Kude lesinye isikhathi ngaphandle kwalesi
aba research bafunze.
Being risky means ukuthi nalokuwa kwayo kulula.
Nathi kufuna senze ukukhicita lokusembili.
When you choose your adventures, you do so with an open heart and a desire for the unexpected. You embark on journeys to discover new worlds full of wonder. You choose a path to awaken your senses A world to make you look up and realize just how inspiring this life can be. Arrive and awaken your heart. Explore life in ways only thought possible in your dreams. Discover just how far you go to expand your understanding of life's greatest mysteries. There's just one place on this planet with so much to offer. Now is the time for you to have the royal experience.
Welcome back. It's 36 minutes after 6. You're still watching Kusile Breakfast Show. This is the Wednesday edition. There's an adage that says health is wealth. In Eswatini, it is fast becoming a national currency that is under pressure. Of course, the state of our health system is no longer a secret. Clinics are battling chronic shortages, hospitals are stretched beyond capacity, and healthcare workers doing the impossible under near impossible conditions. But outside of all this strain, there are flickers of progress, pilot initiatives, digital advancements, and a resilience among professionals that continues to defy the odds. And of course, a conversation that we need to have every day to find the solutions and then proactively and actively work on those solutions. And this morning, we want to move beyond the symptoms. We interrogate the system itself. What is it that is broken? What is working? And what is it that must change? With us is someone who uniquely is placed to speak with depth and clarity, a legal scholar, a health advocate, as well as a practitioner who knows the front lines. Dr. Advocate Dlamini joins us now for this important conversation. Mr. Dlamini, good morning.
Thank you very much. Thank you for having me this morning.
Doctor, you know, it's 2025. We are just starting the second half of the year, and one is always hit by an enormous amount of concern when they still wake up to headlines that speak to the health sector still being in crisis following last year and the year before that and the year before that year. We are still not out of this concerning situation. I was just looking at the headlines myself here from these past publications. This July, we've seen some headlines. June, we saw some headlines. All of them are concerning. Let's get straight to the point. The system is under undeniable strain. In your view, what is the real bottleneck?
I think we have come to a space as a country where we're supposed to stand up. You know, crisis, challenges, they happen everywhere. You know, actually, it's one of the things that tests what we're doing. But at least for this one, one would expect that by this time, there should have been done something. Something must have been done. And as a country was so capable, the government in office should have done something. You know, when you look at the country that it is able even to get support from loans that we can do for dams, we can do for road construction. You know, recently we had got support for foot and mouth disease. Right. You know, I think the same should have been done for the Minister of Health. You know, if they can do all this kind of support that they've developed, I think such could have been done for the Minister of Health. Because with the Minister of Health, everybody would talk about systems, that systems possibly this time around they're grounded. They've been ailing for some time, just that this time around they came to a moment where they showed us that they cannot operate in the manner they're supposed to be, and it get clogged and so forth. But, you know, we could have just got a bypass just by possibly, if it has got to issues of fiscus and so forth, we could have just got a loan somewhere and just stock out all the drugs countrywide once, and then focus on building up whatever that we're building up and see over time how things will be. Otherwise, as it is becoming a crisis, and one would say that what needs to be done. Definitely, answering your question, what will be the bottleneck? I think one of the parts which I would stand to submit today is that I think there's a point of collaboration that we could have possibly done already. Right. If what I've suggested earlier cannot work. Right. You know, we have private sector, we have got public health agencies, that could have been drawn to the drawing board and say, guys, we've got challenge here. What can we do? What can we do?
Yeah.
You know, with the private sector, I tell you, there's capacity. You know, there's capacity. We've got different clinics that are led by individual or that are led by individual colleagues who could play a part. For example, we've got, if I'd mention a few, we've got different clinics, probably, but let me not mention any, who you can say, guys, what can you do for us in this moment? For example, if you approach us, we'll play in the clinics or the clinic group and say, can you procure for us TB drugs so that the nation can get it from you?
Yeah.
Can you procure drugs for NCDs? And so that the country can find it from you. We use those kind of pockets around it to maximize the moment. The public health agencies, we know that they've been challenged by the Trump saga, but I tell you, if this would be tabled to their attention and say, guys, what can you help us with? They could stand up to something. We saw them in COVID-19. COVID-19, when it happened, we had all those challenges, and they showed up, and they were able to push and check into their budget. What can they take from their pocket and put on the table? So, for me, I think there is a collaborative effort that is possibly missing in the game.
Yeah.
Yeah.
I like the fact that you mentioned what we saw with COVID-19 as a mean of, standing up for an immediate solution regarding collaboration, as it were.
Yeah.
But also you mentioned tuberculosis, which, when I look at tuberculosis and I look at COVID-19, the first thing that strikes my mind is that 2011, tuberculosis in Eswatini was declared a national emergency crisis.
Sure.
COVID-19 was declared a national emergency crisis for 2 months, I believe.
Yeah.
How is this health sector that is engulfed by so many challenges not yet been declared a national emergency crisis itself? And I suppose that would then, sort of tickle up all these recommendations that you are making as a point of urgency. Do we need to declare this situation a national health of emergency?
We would have done it a long time ago, but maybe we still need to tick some few boxes in terms of a criteria. How do you find the moment to be a national crisis and so forth? So maybe that criteria has not been met, but as far as I look at it, it is far beyond that.
Yeah, but if of course, we've seen there's funding cuts that have happened with PEPFAR and the USAID. Of course, supply disruptions that have been a conversation for far too long. The procurement issues. I don't know if we still need to tick boxes to declare this a national health emergency, but perhaps going forward, I do pick up from what you are saying that we are facing funding constraints. That is without a doubt. Not too sure about political inertia, but of course, fundamentally, there is a need to prioritize healthcare as a national asset in Eswatini, and it's not happening as much as we want to.
I think it's time for everybody to be brought on the drawing board. Whosoever is leading, whosoever is sitting on whatever chair, it is time to call everybody and say, guys, what do we do? I think if they were able to deliver, they should have done so already. So now where we are right now is an issue that what solution can we work with? So like I'm saying to you that today, I think the best thing is that let's just come to the drawing board and say, which partners do we have? Who is capable of helping the situation as it is, and just lean on those kind of individuals and sort this mess out, because the challenge, one of the biggest challenge, my brothers, I can say today is that not only that I sit on administrative fronts in my institution, but I'm also a clinician. I see clients on a daily basis. And this situation is very, very, very difficult.
Right.
Because what is happening is that when our public hospitals are not able to perform in the manner they do, the people then they start running around and showing up in any door opened, written hospital, written clinic, and when you go there, you find that they expose themselves in very, very serious costs that they've not even anticipated that they can possibly do so. And I think also the collaborating effort that I'm talking about, my brother, it could have also came into that space to say, okay, fine, while we're still building up capacity to get the drugs in the country, but you private sector, you private clinics, you private hospital, let's create a mechanism that how do you support this moment? can you kind of like adjust your costs so that a patient who's coming from government who cannot match the cost of that private clinic, something can be done, a prepared kind of like mechanism. For example, if you talk about the consultation in the private sector for a patient to see a doctor, which is maybe 400, maybe 420 and so forth, then we say that, can you prepare a package that can be at least user-friendly? Because with government, these people are used in paying something like 10 rand, 20 rand and 50 rand around there. Maybe something like 100 rand or 200 rand for a consultation, so that these people can now use the private sector as means to kind of like survive in this moment. We just need a survival mechanism that can be put on the space for the public to come and kind of like use at this particular time while government is pushing hard to get things done on the other side.
Survival mechanism, something that should be noted, and I hope the right ears are listening and making those notes, and hopefully all the stakeholders that are necessary for that to happen can correlate and do good with that. But I want us to look at the glimmer of hope that we have seen in the midst of all these challenges, because, of course, with the struggling system that we have been seeing, we've also seen some moments, we've seen some instances of innovation, if you like. We've seen the care that points to something better. Are these outliers, or are they early indicators of what's possible when intent meets execution?
I think those are tools that we should be happy to have. And they're here to make a difference. But, you know, when you have to bring tools, if you're to be kind of like driving a car and you've got the best tools for you to use and so forth, first of all, the car should be alive. The car should be functional. You know, the car should be functional. The car should be moving.
So what you're saying is, if we are going to fix the health sector, it is not going to do us any good to clap hands for a fix on perhaps the engine when the suspension is not doing well. It needs an overhaul. It needs a complete fix.
I'm telling you, you cannot celebrate a tie if you're to buy a tie for a car. Even if you can tell me that you've bought it from an expensive manufacturer, it doesn't matter. Where the tie must fit, it is a car that is dead.
The bushes must be all right. The clusters must be all right.
I'm telling you. So the most important here, the Minister of Health has to come to that space. We diagnose exactly what is happening and fix it accordingly. And then you can put all the innovation that you want, and things will be okay.
So I did some research on some of the most promising developments underway in Eswatini's health sector, and I want us to look at those, and perhaps you may suggest which ones need to be ramped up or what else can be added. Of course, digitization via the CMIS rollout. We've seen over 220 health facilities that have been implemented the client management information system, which is critical for patient, of course, patient tracking and record keeping. But there's also been the central medical stores reforms, which is very critical because, we saw the stock take that caused delays and everything that happened there. In infrastructural and emergency readiness, very, very important. I think that is self-explanatory. There's also strategic leadership and fiscal support. We're seeing a bit of that. The World Bank-led public finance review in February 2025 that targeted better health sector budgeting. We hope that is being implemented because some recommendations are made and they are never implemented. And then and non-governmental innovation, the Look Commission. We've seen what happened there. 300 patients a year, all those statistics, which is good. So I broke it down to areas and why it matters. Data and workflows, supply chain resilience, access to critical services, fiscal policy backing, and public-private synergy. And you spoke on that. What needs to be ramped up?
To be honest with you, I like all these things that you've just mentioned. The point is to say that while we have this crisis, and the day should not hold us at ransom. Certain things must move.
Sure.
So we cannot look at this problem as big as it is, as sensitive as it is, but other elements of development should also be allowed to go on, to keep on moving like we've just mentioned it. But right now, where we are, I think the biggest one that needs to be developed to the core is the supply chain mechanism. That one speaks to the crisis we're facing today. If there is something that is being done in that space, we need to do it against time. If not, that we're late. You know, so that I've got to do whatever that is being fixed there. I know that Global Fund was also sitting in there at CMS to make sure that the procurement system is coming on board in the best way it's supposed to. But I think what would then make us to feel it is not helping is because probably there is no surviving mechanism that we have developed. In the meantime, that kind of a system is coming to fruition. So that is the challenge that I have, is that such that you may find ourselves in the day putting pressure to it to be ready too earlier than the actual time.
Yes, yes.
And this calls for a lot of resources if we're developing it. So for me, I still feel it's like my brother. We have a road here in Babane that goes to Manzini. We have Malagwane. When Malagwane is clocked with an accident, and it is quickly announced, and we quickly develop a bypass road so that people can keep moving. The same that I'm saying today is that in all what is being done to fix the challenge that's got to do with Ministry of Health, we could have created a bypass mechanism, a surviving mechanism that should still continue to service people while we develop whatever that we're doing. Because if we don't do that, even that which we're developing, even that which we're building up, we put ourselves to unnecessary pressure. We may not fix it the best way we're supposed to because we are rushing it, we're putting pressure to it and so forth. And it may cost us with time that it was never fixed and developed in the best manner it was supposed to be developed because we're pushing it too hard to deliver. A simple mechanism to survive in this moment. They could have just got a loan and bought some drugs for everybody in this country and make sure that it goes to the public while we create. And generally, to be honest with you, the old system that we had, even before now fixing and building up a new one, if possible, there's a new one that is being developed. We had the old mechanism of just dispensing tablets. It is a simple mechanism that was there before time, that you can just have drugs, have them in the pharmacy, and they are released to patient through dispensary on a daily basis. Before coming to the innovation, state of art, whatever, those things for us where we are today, we need tablets to put on patients on time.
Yeah. The health sector, I think what we have done is we have pretty much looked at every body of it right now in terms of the challenges that it has.
Yeah.
And going with the body example, we are going to now go into the heart. And I believe the heart of it is its people. We are talking the practitioners, the doctors, the nurses, and the health workers that are quite frankly leaving. Some are burned out or simply underpaid, as they say. We've seen such a huge number of them go into the United Kingdom, and they cite these challenges. What does a serious human resource strategy for the health sector look like in Eswatini? And what have we failed to confront about this ongoing exodus?
To be honest with you, my brother, I would say the Ministry of Health had always had challenges. Challenges of development, challenges of meeting targets, as per every document that has been developed. We normally have what we call the National Healthy Strategic Sector Response Strategy, if I'm calling it right. It normally goes for 5 years. That defines how things are supposed to be done in that period of time.
Yeah.
And such that if you do a review of it, it will always tell you that certain things have been done, certain things have not been done. So like in any organization. But what I want to tell you is that everybody else, including the human resource, the doctors, the nurses, and everybody, they've been able to continue working, to tolerate whatever that has been happening. You know, my brother, when the issue of supply chain happened, it took the last energy everybody had away. Because remember what is happening. It is, you would possibly have shortages of human resource. You'd have shortages of that, challenges of payments. You know the on-call thing, that at some point in time it has got its own peak moments where the health sector or the doctors and everything would stand up for it. But when the supply chain issue happened, I'm telling you, it created serious challenges because at least those few doctors, those few nurses, those few whosoever would go to work, they would able to execute their job from A to Z, from morning to sunset, while they were to work. when you take away the tablet, I told you the other time when I was doing an interview that for me as a clinician, for my colleagues who are doctors, nurses, when you take away a tablet from them, a tablet to them is a tool. It validates what they are doing. It validates the work they are doing. For them to feel fulfilled. Remember that doctors, nurses, and everybody, they are not robots. They're human beings. They've got that level of being satisfied that I have gone to work today and I've done my work. I can sleep peacefully. I could be tired because the shift was long, but I've done my part. So what is happening is that if you take away that thing called a tablet on their desk, you're taking away one of the best tools which validates what they are doing. So at this point in time, I understand their devastation, the way they've stood up. It is because they don't have the full satisfactory when they go home to say that I have worked well and I've delivered according to how I was trained. So it's important for it to come back. I tell you, if it can be brought back, you'll see a difference.
The last one for you. Every effective system has its moonshot, so to speak.
Yeah.
A bold decision that shifts the landscape.
Sure.
And it's quite needed very urgently in the health sector. If you had the mandate as Dr. Advocate, what is the one transformative, perhaps even controversial policy move that you would make to enact without delay?
I think in terms of write-ups and policy, we're fine as a Minister of Health. Even government has positioned themselves so well. Now it's execution. I was going to strengthen execution.
So the non-negotiable for you that must be gotten right is execution.
Execution. I'm telling you, you come to write-ups, if you can read documents from government, I read them all the time. You read Minister of Health, you read government as a whole, they are on spot.
Dlamini.
The point that is missing is execution.
Thank you. Thank you for your time. This is Dr. Dlamini, very insightful, very grounded and uncompromising, if you like. This morning's conversation with Dr. Advocate Dlamini reminds us that the health of a nation is not simply a budget line item or a policy target, if you will. It is the living measure of our national priorities. So we've heard the diagnosis, the systemic strains, the human toll, which is just spoke on, as well as the persistent gaps. But we've also heard the prescription, strategic reform, political will, and the reimagining of health, not as a cost, but as a constitutional commitment. And as the kingdom weighs choices in the face of constraint, one truth endures: every reform that is delayed is a life that is deferred. And of course, he emphasizes on the imperative of supply chains as sitting at the center of what could be the most necessary reform here. So thank you to Dr. Dlamini for his clarity and for his candor. The work I heard is urgent, but as we've heard today, it is not impossible. So we hope for a more optimistic future. So that is our conversation. Any parting word that you want to say? You have a minute.
Just to say to the public and everybody else there, while we have this situation on our table, we ask for resilience. Can they please work with us? All the parties involved, let's soldier on. It's going to be done. Next year, by this time, we'll look back and say, we had the challenge and we've conquered.
Dr. Advocate Dlamini, ngeke ngigitsa ligogweni bongo sisi tabahlola emarket esitabuya nenzabathe futhi singisi.
Eswatini TV has signed a code of conduct that is enforced by the Eswatini Communications Commission. We are committed to reporting news that is accurate, comment that is fair, and programming that does not amount to hate speech or the description of gratuitous violence or explicit sex. For any complaints of our programming, please contact us on 2411-9600 or email info@eswatinitv.co.za. You can also contact the Eswatini Communications Commission on 2406-7000 or write a letter to ECCOM on PO Box 7811 Mbabane. Email address is info@ecom.org.sz.
So welcome back at 7 a.m. and we are going to enjoy our English bulletin now. His Excellency the Prime Minister Russell Dlamini commends World Vision for its continued support to the kingdom through various initiatives, including improving access to clean water and electricity. The Prime Minister has announced that World Vision will this week launch a water project that is going to benefit 200 households. The Prime Minister has made these remarks while bidding farewell to the outgoing National Director of World Vision, Tina Mukunda.
His Excellency the Prime Minister Russell Dlamini has bid farewell to Tina Mukunda, the outgoing National Director of World Vision Eswatini. Mukunda, who is set to leave the country in August, was recommended for the remarkable impact she has made during her tenure. The Prime Minister described the relationship between World Vision and Eswatini as reciprocal and collaborative, particularly in critical areas such as water, sanitation and hygiene. The Premier said one of the notable initiatives is the WASH project, a joint effort between World Vision, the Ministry of Natural Resources and Energy and the Eswatini Water Service Corporation. During the meeting, the World Vision team shared plans for an upcoming water project scheduled to be launched this Thursday at Futfugani in Mhlangatane in the whole region. This project, developed in collaboration with the local community, is expected to benefit 200 households by improving access to clean water. Looking ahead, World Vision outlined its ambitious target to reach 329 people across Eswatini over the next 5 years. The organization said it was currently developing a new strategy to guide this expansion with input and support from government. Discussions also focused on child protection, with World Vision reaffirming its commitment to providing psychosocial support, addressing violence against children, and tackling gender-based violence. The Prime Minister expressed government's continued support for World Vision's effort and reiterated its own commitment to achieve universal access to water and electricity by 2030. A national goal already in progress. The engagement included valuable exchange that will contribute to shaping World Vision's upcoming strategy. As the nation prepares to welcome Amos Zaindi, the incoming national director, the Prime Minister extended best wishes to Mukunda in her future endeavors and expressed appreciation for her leadership and service to the Kingdom of Eswatini. Reporting Sondomlangeni, pictures sourced from government's Facebook page.
Well, the program titled Asibuyisane Sibe Ngumndeni will start airing tonight, 9 July 2025 at 8 p.m. here on Eswatini TV. The Deputy Prime Minister, Honorable Thuli Ladla, has encouraged the nation to tune into Eswatini TV and watch the show that promotes family unity and togetherness. The program was produced by Eswatini TV in collaboration with the DPM's office as well as the Embassy of Taiwan in Eswatini.
Cela kusho ukuthi uma unasigujana wakho ekhaya ngalesithathu lo wakusasa mhla ka9 nga8 uma shuthi ulala nga7 hlala ke uthi ngoba nga8 kungena luhlelo.
I'd like to encourage everyone with access to Eswatini TV to watch the program titled Asibuyisane Sibe Ngumndeni, which will air tomorrow, 9 July 2025 at 8 p.m. This important program was officially launched by Their Majesties in Parliament. The Deputy Prime Minister's office is using this platform to raise awareness about the importance of family unity and responsibility. The campaign strongly discouraged the abandonment of children and elderly parents. The program aims to show the importance of love within families as it creates peace. And where there is peace, there is success. Children who grow up in loving homes are more likely to spread kindness. On the other hand, a lack of love breeds bitterness. It is also believed that neglecting the elderly can bring misfortune, as they have the power to bless or curse based on how they are treated.
Every year, the Kingdom of Eswatini records about 25,000 industry-ready graduates, yet the job market only consumes about 1,000, which leaves the thousands of youth without jobs. Now, speaking during the Career Expo held for out-of-school youth in the Hoho region at Kilani Stadium, the Honourable Minister of Labour and Social Security, who also represented the Honourable Minister of Sports, Culture and Youth Affairs, highlighted that unemployment drives most youth to crime as well as drug abuse. Hence, the solutions are needed urgently.
The Minister for Labour and Social Security, Honourable Pilar Buthelezi, says the government should implement ways to fight the ever-rising rate of unemployment in the country.
We are collaborating with key development partners, including the European Union and the World Bank, who are investing millions into initiatives designed specifically for out-of-school youth. We are advocating for more inclusive funding, especially for young women, and expanding entrepreneurship pathways so that young people are not just waiting for jobs, but they are creating them.
Dr. Glory Dlamini, the Deputy Mayor for Pickspeed Town Council, elaborated on that investing on youth-driven projects could help curb the rate of unemployment in the country.
As we are all aware of the swift escalation rate of youth unemployment in the country, it is of paramount importance that we come together and formulate coherent and sustainable solutions.
The Eswatini National Youth Council's Chief Executive Officer Lwazimamba encourages the youth to venture more into blue-collar jobs compared to white-collar, since they are the drivers of today's economy.
Umsebenzi losetandleni takho wende ngemandla akho onke kube bede lesiyibukela phansi bekunene.
Studies show that the country is lacking in the skills sector, hence investing more in that field could help curb the rate of unemployment in the country. Reporting for Eswatini TV News, I am Thabiso Mapanga, Pickspeak.
Well, the Honourable Minister of Tourism and Environmental Affairs, James Milane, has officially launched the Safe Skin, Bright Future campaign. It aims to assist people with albinism by providing sunscreen and protective gear. The minister has launched the campaign during a presentation of protective items to people with albinism, which is worth 75,000 emalangeni. It was held in Babane.
People with albinism are more vulnerable to harmful sun exposure due to the lack of melanin in their skin, yet access to sunscreen and protective gear remains a challenge. In response, the Eswatini Environment Authority has launched the Safe Skin Bright Future campaign, providing a protective gear to people with albinism, especially children. The Minister of Tourism and Environmental Affairs, Honourable James Milane, says the campaign will play a huge role in raising awareness about the Montreal Protocol.
In collaboration with the Stukimota Foundation and the Ministry of Education and Training, learners living with albinism have been identified across all 4 regions of Eswatini. These learners will be provided with sun protection kits, which will include sunscreen, Aquarius cream, and protective sun hats to help safeguard their health and well-being.
Senator Stuki Mota, founder of the Stuki Foundation, welcomed the support, saying that it will go a long way.
To many, sunscreen may appear as just another skincare product. But to persons with albinism, sunscreen is not a luxury. It is a shield, a lifeline, and a critical part of our health and well-being.
The UNDP representative, Pinky Sithole, also commended the campaign for promoting inclusion.
While the Montreal Protocol is best known for phasing out ozone depletion substances, its benefits extend beyond environmental protection by reducing substances that thin the ozone layer. It directly contributes to lowering UV radiation exposure, protecting people, especially those with albinism, from life-threatening harm.
Eswatini is a signatory to the Montreal Protocol and continues to make progress in reducing emissions of harmful gases. Reporting, Sondomlangeni, Mbabane.
Now, with the aim to consult as widely as possible, the Senate Portfolio Committee on the Deputy Prime Minister's Office is engaging stakeholders in the promulgation of the Disaster Risk Management Bill of 2024. Now, different stakeholders have been making submissions to the Portfolio Committee in a consultative meeting that was held at the Senate chambers in Parliament.
The Portfolio Committee's acting chairman, Senator Kusile Dlamini, explains the importance of the stakeholder engagement since the bill was first drafted in the year 2024.
Kune-bill lesinayo yaka-DPM sekunemalanga noko siyicalile sebasuke-workshophile ngayo ukuthi itawusebenza kanjani. Kafisha nje bezama lokuthi national disaster azame lokutimela.
He says the bill under discussion is that of the Deputy Prime Minister's Office Portfolio of Disaster Management. He says as several consultations on it began last year, it has become clear that for disaster response to be prompt and efficient, there needs to be reforms in the procurement processes for disaster relief. Part of the content of the bill is the establishment of the National Disaster Management Authority, the prevention of disasters and mitigation, amongst others. Stakeholders who came through to make submissions to the Portfolio Committee highlighted issues that include the effective provision of assistance to the public during and after disasters, as well as creating synergies in disaster and climate change laws and interventions.
Kunekudla lekungenako even kuchamuka kulamanye emave. Kunetintfo lesitikicita kangwane lesititsengisako sitidliwe ngemaswati.
He says since the country imports and manufactures some edibles, it is imperative to ensure that in as much as the food may be directed to disaster relief, SWASA must endorse it as of acceptable standards for human consumption.
Amendments that the DRM plan shall include guidelines for community-led recovery, infrastructure rebuilding, and psychosocial support. I'm sure if anyone's experienced some of these disasters, it can weigh heavily on people's mental health. They may have lost valuable possessions, they may have lost their car, their house, and their livelihoods, and there's a lot of mental health.
He says the inclusion of indigenous knowledge in this bill is very important, as we may all know that Eswatini have their own way of detecting future calamities through studying the environment and referencing to past environmental changes and patterns and sequence of events. The Portfolio Committee's acting chairman, Senator Kusile Dlamini, further explained that the next step is to present the bill to the House of Senate, where it will be looked into clause by clause, consider recommendations of the House of Assembly before it is eventually passed into law. Reporting, Mbongwa Dube, Lobamba.
Well, the Eswatini National Trust Commission under the Ambuluzi Ecosystem Restoration Project is validating 2 documents which look into communication and integral land management strategy. ENTC-CE Tulani Metula says during such projects, it is important to have communication and to preserve the environment.
This project is a collaboration between the Eswatini National Trust Commission, supported by Global Environment Facility and the United Nations Environment Program. Chief Executive Officer at ENTC Tulani Metula says the project addresses the growing environmental challenges, especially facing Mbuluzi River Basin, which is one of the major rivers and is shared with Mozambique.
We have to ensure integration and we have to ensure communication and collaboration. And it has to be effective to ensure the success of the project. So the communication strategy is going to assist us in that regard. As coming to the integrated land management strategy, as you would know, that land is an important factor in terms of conservation. With this project specifically, the Mbuluzi Ecosystem Restoration Project, it's embedded on land. The ecosystems to be restored are degraded ecosystems. So we're looking at facilitating such. And these ecosystems, as we are saying, they are bordering on land. So developing an integrated land management strategy is a core component of this project, which is under component number 4 of the project. It is going to entail improvement of livelihood.
Project manager Kusile Dlamini says they are looking into creating initiatives that will preserve the environment.
The Integrated Land Management Strategy and Action Plan informs project interventions, and we are launching it together with our communication strategy, which we hope to use to amplify the work of the Mbuluzi project across the landscape and nationally. We also hope to use this communication strategy to drive behavior change.
Secretary General at UNESCO Eswatini Lwandle Simelane appreciates being part of this project.
We are really focused on the youth and schools. So this project is an extension to show the learners and the teachers and the communities at large that it goes beyond. Njengoba nibona nje Mbuluzi ecosystem restoration touches on many areas, even regions. So that speaks to what we do in our communities does not only affect what's happening within the community.
This project costs $3.8 million and is expected to complete in 2027. Reporting is Satable Mamba, Nombendilo Shabalala, Bongani Masugu, Nzulwini.
Two Eswatini who left Eswatini in 2022 to pursue their police studies in Egypt have come back after the completion of a program called the African Police Cadet. National Commissioner of Police, Vusimanoma Masango, says this partnership will play an integral role in sharing information and new tactics on solving crime.
The program is part of the Memorandum of Understanding between Egypt and Eswatini. The National Police Commissioner Vusimanoma Masango encouraged the graduates to share what they have learned with other police officers.
Before the training board,
Masango says they should go and appear before the training board and present their story to convince them that they come with something different. The graduates applauded having been given the opportunity and shared their experiences.
Mpendula
says they appreciate the opportunity and promise to help and contribute immensely in the police fraternity in the kingdom.
Forensics, criminal investigation.
Kulekani says they gained knowledge in criminal investigation, forensics, communications, and leadership, to mention a few. This program allows students every 2 years to pursue their diploma in police science in Egypt. Reporting is Setable Mamba. Pictures were sourced from the communications office at the Eswatini Royal Police Service.
And now sports news. The Region 5 Youth Games have entered day number 4. It entered it on Tuesday. Different sporting codes such as judo, athletics were all in action. And the Eswatini Sports and Recreational Council's communication officer, Dumsani Ndiwane, has assured the nation that there is still a chance for the country to get more medals, despite a disappointing start by some of the sporting codes.
The Region 5 Youth Games entered its 4th day on Tuesday, with the country's only medal coming so far from swimming athlete Hailey Hoy. Other sporting codes such as football and netball encountered a negative start to the tournament.
Tindondo solo sifuna tona solo sisaphethe inye ya Hailey Hoy la itfoleka swimming.
Communications officer at the Eswatini Sports and Recreation Council, Dumsani Ndiwane, he expressed their commitment to the team, saying that Eswatini, even though in some sporting codes the results have not been positive. Ndiwane, however, encouraged the country to remain behind the team in the remaining games of the competition. Ngospayo Mgabi, who is amongst the boxers in action on Wednesday, has also promised that as a team they will do what it takes to get back home with medals. Other boxers in action on Wednesday include Sihle Stole, Andrew Mkoko, and Sponiso Viragati. For Eswatini TV Sports, Fabiso Msonera, pictures sourced from the Region 5 Youth Games TV.
Eswatini Football Association, in conjunction with the FIFA, are conducting a FIFA MA Youth Referee course at the Technical Center, Lobamba.
It is a pleasure on behalf of Eswatini Football Association to have been invited to make a statement to launch the FIFA MA Youth Referees course 2025, having commenced this Monday and to conclude on Friday of this week. Fundamentally, may I commence my statement by convening a wholehearted welcome to the FIFA referee experts Paulo and Hanach, who have been sent by FIFA to impact expertise and experience to our young referees. You are welcome in the Kingdom of Eswatini, sir and madam.
First of all, thank you to Eswatini Federation to give you this opportunity and organize this course for youth referees. This is really an opportunity for you. So we will try during this course to share with you the new FIFA teaching material, to share with you the new refereeing training concepts. So we are here to help you to share the maximum of knowledge relative to modern refereeing.
Right, that marks the end of our English bulletin. We'll go for an ad break and we'll be back shortly.
We're standing here in front of the statue commemorating the smallpox eradication campaign. Smallpox being the only disease that the world, humanity, has eradicated. This WHO-led campaign was the first mass vaccination campaign that brought together countries, experts, and communities. Today, we have 30 vaccines that can prevent many, many diseases. And 154 million lives have been saved in the last 50 years by just 14 of those vaccines. So if you're a new parent, you may have questions about vaccines. We have Dr. Kate O'Brien here with us to answer your questions. Kate, let's start with, parents may have heard, what if we let our child get sick and develop immunity rather than vaccinate them? What is your advice regarding that?
The first thing I want to say is that the vaccines that have been developed that are in our program are vaccines against serious diseases. Sometimes we hear the term natural immunity, and I really want to address this question. Some people think that getting infected is somehow more natural than it is to develop your immunity from a vaccination, and I really want to disavow this. It's the immune system in either circumstance is responding to either a germ or the vaccine itself. What's most important is that exposing children to infections and risking the consequences of serious disease, and in the worst circumstances, death, is not what any parent would want to do.
Another question that young parents may have is, if you give a child many vaccines at the same time, you might overwhelm their immune system. What would you say to that?
Children are exposed to, in fact, millions of different microbes in the natural environment around us, in their foods, in the environment, by touching things, in their own bodies. We all have, in fact, more microbes in our body than we do human cells. This is an important way that children's immune systems develop. The issue is how to allow children to develop immunity against those germs that are consequential, that are serious, that cause disease. So the point around the vaccines is children's immune systems are more than able to respond to multiple vaccines given at the same time and multiple doses that are given over the course of their lifetime. Although we perceive that they're being given, quote, a lot of vaccines, in fact, on a daily basis, children are being exposed and sampling that outside world of those microbes all the time. The immune system is an incredibly powerful system. It's amazing the way that it matures and identifies which is friend and which is foe in the environment. And vaccines are the safest way to actually derive protection for children, adolescents, and adults against the consequential germs.
Can parents maybe stagger the schedule, give a little space? Would that still have the same impact that you're seeking in protecting the child?
Yeah, so this seems like a common sense, logical thing to do. We have studies that tell us in what sequence the vaccines should be given, how many doses should be given, and how far apart they should be. Now, when you mess around with that schedule, there are consequences of doing that. First, it means that children may miss the doses that they should get. Second, it means that they may not get the vaccines at the time when they most need them. We time the schedule so that the protection is developed before the period of time when children are most at risk of the particular disease that the vaccine is protecting against. And third, there are some vaccines that need to be timed relative to other vaccines that are in the schedule. They don't work as well if they're timed incorrectly. So that's the reason why we have pediatricians, scientists, epidemiologists who make the recommendations within each country for what the schedule should be.
So WHO makes a recommendation, right? But who's deciding on what vaccinations a citizen receives?
Countries are the ones who decide on their schedule. What WHO does is, because we're a global recommending body, we pull together experts from around the world. We ask them to look at all of the evidence that is available, and we provide recommendations to countries. They can rely on the aggregated evidence that we've put together so they can also deliberate on what makes most sense for their particular circumstance.
Thank you, Kate. I have additional questions. I'm sure our viewers have additional questions. So we will take this in part 2, where we will answer some of your questions on vaccines. Until next time then, stay safe, stay healthy, and stick with science.
Hi, I'm Golda. I work here at the IMF. Our aim is to provide the best possible advice on economic policy to our member countries, helping them to create conditions so everyone prospers from economic growth. One question our economists are always getting: how can we reduce poverty and foster inclusive growth? There are a few ways to think about it. Some say the government should be heavily involved in the economy, with regulations to keep people safe and high taxes that fund and support a healthy, well-educated and inclusive society, even if it's at the expense of higher growth. Others believe that the government should have little or no part to play in the economy. Lower taxation means more money in everyone's pockets. More individual freedom, they say, means more economic growth overall. But maybe there's a target we all could be shooting for: the best policies on inclusion and growth. Essentially, inclusive growth is about making the economic pie bigger and sharing those slices more widely. So, how do we get there? By aiming for a middle ground. Both sides mostly recognize the need for social safety nets, public pensions, unemployment insurance, food programs. These measures prevent extreme poverty and provide a basic standard of living. At the IMF, inclusive growth is central to our work because reducing poverty is in everyone's interest. Part of having a free and equitable society is ensuring we all benefit from its growth, no matter who we are. And it's not just about creating a fair and equal chance to succeed for individuals, regions, or countries. It's about distributing growth fairly for future generations too. Overall, inclusive growth is based on the idea that wealth creation, economic freedom, and equal opportunity can and should coexist.
Eswatini TV has signed a code of conduct that is enforced by the Eswatini Communications Commission. We are committed to reporting news that is accurate, comment that is fair, and programming that does not amount to hate speech or the description of gratuitous violence or explicit sex. For any complaints of our programming, please contact us on 2411-9600 or email info@eswatinitv.co.za. You can also contact the Eswatini Communications Commission on 2406-7000 or write a letter to ECCOM on PO Box 7811 Mbabane. Email address is info@ecom.org.sz.
Kude lesinye isikhathi ngaphandle kwalesi.
Aba research bafunze.
Being risky means ukuthi nalokuwa kwayo kulula.
Nathi kufuna sente ukukhicita ngokusembili.
When you choose your adventures, you do so with an open heart and a desire for the unexpected. You embark on journeys to discover new worlds full of wonder. You choose a path to awaken your senses, a world to make you look up and realize just how inspiring this life can be. Arrive and awaken your heart. Explore life in ways only thought possible in your dreams. Discover just how far you go to expand your understanding of life's greatest mysteries. There's just one place on this planet with so much to offer. Now is the time for you to have the royal experience.
Asmenze sinemogela, it's 28 minutes before 8 o'clock. Sikhulumisana na Prudence Mnisi lo sowenkapanini Center for Financial Inclusion. Sikhuluma ke ngetindzaba tema finances, how to manage or how to improve your financial health. Tindzaba letimcoka ke leti njoba labanye bantfu baya bathi khanse sabaseti kweletini kakhulukati nasekuphethe umnyaka. Labanye ke bafisa netijabulisa ngetikhatsi tema holiday kepha ke imali kusuke sekude ngaloko ukuthi basuke bangakakhoni ukuthi ihlela kahle kusukela kusaqala umnyaka. Labanye ke bayenda ema commitments naqala wona umnyaka ukuthi batawu budget batawu save batawu investa imali yabo. Sifuna ukukhulumisana naye Prudence kuva ukuthi how do we actually manage our finances singadodi khansa sesiboleka imali kuboshaya lokho sesiboleka imali singakhoni nekoti bhadala. Prudence asikuvuselela mhla ekseni. Thank you for coming through to the breakfast show. We are halfway through the year and kunebamhla abaningi labenda mhlambe ama commitments naqala umnyaka sesema ukuthi basahambisana nawo lama commitments but lomunye uyabuka ukuthi umnyaka so uyaphela we halfway through mhlambe sofuna ukuqala ku save sofuna ukuqala ku budget ngombe basola asabuka tikweleti. I think nje nasingakhulumisa kahle kahle nasithi nje sikhuluma nge financial health sithini kahle kahle what are we talking about?
Good morning Lulu and good morning to our viewers at home. When we talk about financial health, we're talking about a situation whereby, as an individual, you are financially sound, psychologically, socially, and materially. You cannot talk about financial health outside of those three key elements. So that is important that if you are financially sound and you are healthy, you know that no matter what, in terms of my finances, I don't have stress. Be it in my social environment, be it psychologically, and in terms of meeting my day-to-day needs.
Yeah.
So that's financial health.
Okay. So nasikhuluma nje kweqala nje ngiyadihlela kuqala umnyaka ngifuna ku make sure ukuthi ama finances ami are in the right order. Yini kahle kahle the first step nje lekumele ngiyende nangifuna ukuthi nakuphela umnyaka imali dami tonke tibe tikahle ngathi khansi ngisetikweletini.
I think this topic is a subject of discussion every time. It's very important that as people, we know that we earn money, be it on a weekly basis, monthly basis. So you need to know where your money is coming from and where your money is going to. So planning and budgeting is very important. You need to, before you spend, just create a budget for yourself. That is very important. Because in that way, you are going to be in a position to track your income and where your money is going. And the good thing about it is we might be in the middle of the year, but it's never too late if you want to take that intentional step and start doing the right things, because you know where you want to go in life. You don't want to eat your tomorrow today. So it's just important that you set your goals, you set your budget, and then you start planning towards meeting those goals that you have as an individual.
Yeah. So when you say we should budget, many of us have different lifestyles. What exactly does budgeting entail? Yini kahle kahle lena lekumele ngi-include kule budget yami?
In your budget, first of all, you want to have your income. And once you know that this is my income, you know what your needs are. You have transport, you have school fees, you have rent, and you have other things that you want to achieve, including your savings. It becomes part and parcel of your budget. You don't save outside of your budget. Everything that you want to do, it's entailed in your budget that you do. And then once you have set your goals, then you sit down. This is my income. You create your monthly budget. And the good thing about creating your monthly budget, you are able to trace your expenditure, such that today it's even important because those that have smartphones, there are many tools in your YouTube and in the system that you can use to create your budget, and it will actually tell you where most of your expenditures are, and we are able to play around. If you can even have a graph, it will tell you that no, this month it seems I've spent a lot buying meat, or I spent a lot buying toilet papers. What is happening with my budget? We are able to trace from your expenditures from last month, and we are in a position to compare. So that is very important. Comparing, so that in the next month we are able to adjust and to actually tell that maybe I've spent a lot of money because the prices were too high in the shops. Next month when I go, maybe I need to start comparing, then so that I try, and I'm intentional in trying to lower my costs in terms of how I spend my money.
Yeah, but is it even feasible, saving and budgeting whilst you have so many debts? Some of us have so many debts. Is it feasible to come up with a savings plan, budgeting plan? It can be.
It's feasible. Like, what I want to say to the viewers at home is, we are not talking when we're talking about saving and budgeting and managing your money, we are not saying you'll be perfect, but we are saying you need to be structured and intentional. You have debts and you want to save. You need to be intentional. That's the good thing about them. You can manage how you want to reduce them, so that you start building your savings. So there's no way where one can say it's not possible. Everything is possible if you want to, and if you want to be intentional. The thing is, you need to make that decision and take that decision that with these debts that I have, I just want to reduce them, so that I start building my portfolio in terms of saving. And you must remember that we are now talking about savings, but savings, you just want to cushion yourself for the rainy days. Savings may not take you to the future that you desire. You saved, and now you need to start about building your wealth, creating your wealth, investing. So if you have not started with saving, when are you going to start investing for your future and building a legacy for your children?
True. Still on savings, consumers are being advised to save money from the beginning of the year, and you find some people saving their monies through different investments or various avenues. Is that safe? Is that advisable? Labanye bayasebatikhanza sabasala nemali lencane just in the name of ukuthi bayasave imali for rainy days. Is that advisable ukuthi so tikhanza sosala nemali lencane ngenxa nje ukuthi ufuna kusave imali?
That is not advisable. You find that I have a stokvel, 3 stokvels. I am also saving with these other institutions. then it's not working to your advantage, because now you start not enjoying your money. If you have a goal, you then know where I want to save my money for what. I cannot be saving in 3 different or 5 different places such that you don't even enjoy the money. While you are saving, at the same time you are creating debts.
So how do you suggest consumers do it?
Consumers should just, if you really want to build your portfolio, number one, you need to invest with the regulated entities. Save with the regulated entities. But also with the regulated entities, we find that people will go everywhere now trying to save, because we are not getting the desired interest from our savings. But the best thing then is to get a financial advisor, so that they are advising you in terms of how best to save your money in a manner that will actually benefit you at the end of the day, that rather than taking 5 different savings mechanisms in the sense that you want to try and improve your savings portfolio. That is not going to work for you.
Yeah, same with investing, you know. Also, we get advices on investing for our future, and you find people, again, having different streams of investments plans. How do you suggest we go about in investing our monies?
Again, in terms of investment, it goes back to, I think for savings and investment, it boils down to the question, why am I doing it? And once you are in a position to answer that, why am I doing it, then how do I need to do it in a better way that will help me improve that? Then once you have identified the how, you'll know where to invest your money and get the desired yield at the end of the day. So it goes back to saying, let me just seek for a financial advisor to advise me in terms of which portfolio is going to give me better yields at the end of the day. Saving and investing, it requires for us to always seek for knowledge and advice and information. You cannot do it on your own. You need people to help you so that you are able to channel your investment and money in the proper way. And you know that when we have invested in a secure institution whereby even if something happens in the economy, your money is safe. You know that you are still going to get your money.
Okay.
Yeah.
So there's a person right now, Prudence Lokagegile nje, they're in so many debts right now, but they want to start over. What's the first step nje in like Melayende? We have different financial institutions like Eswatini, la Sitago, bamfula bacakekile. Yini lekumele ayende mhlambe kuzama ukuthi abhadale tonke letikweleti leti atokhona ukuthi aqhubeke nempilo.
First of all, do you want to come out of debt? That's the question. Do I want to come out of debt? And do I believe that I can come out of debts? Because coming out of debts, it calls for adjusting the way you live your life. So, but the unfortunate part is so many people are not willing to adjust their lifestyle. You know, when it comes to issues of investing, it's actually better to start early and at the right time. But if you have not started early and at the right time, and you find that yourself in that situation, it's good when you have debts. You know who you are owing and how much. You just need to first yourself to sit down and list all your debts and identify the people that you are owing. And the good thing about is if you approach your debtors, they are in a position to negotiate and discuss with you, and you agree. Maybe some they even restructure the debt to enable you to still sustain your life and be in a position to meet your day-to-day obligations. But the bad thing is we don't communicate and we run away. And the more you run away and you have debts, your debt increases because it accumulates interest. That is what people don't understand. Running away, and it makes that debt now to be more costly. So it's better to sit down and calculate your debts and then approach the financial institution or the person that you are owing and then agree on the terms and conditions in terms of how you want to restructure, with a view of saying we are not going to take another debt, because that's the problem. You find as we go and we have our debts restructured, but at the same time, because now I'm able to breathe and there's that income that is coming in, then I want to go to someone else and then borrow. So what's the use? So that is why I'm saying restructuring your finances and managing your finances, it requires for one to be intentional.
True.
If you are not intentional, then we are not going to come out of it, or we are not going to even save or invest.
Yeah. Then there's the 50, 30, 20% rule. Is it practical? Does it work for people? Do you actually have people that have commended it?
Many people, it works for them. But again, it goes back to saying you can do the 20, 30, 50. Particularly, you know, if we are employed for the first time, you don't have so many obligations. You are just yourself. And we have already set your goals to say, by the next 5 years, we all have our next 5 years. And how we get to the next 5 years, then you say the 20, 30, 50 is how much do I want to go into my investment? How much do I want to go into my savings? And how much am I going to spend just to meet my day-to-day obligations? It works for some, it doesn't work for some, depending on how much you are indebted. You cannot maybe apply that rule. But if you are a first starter in the process of wanting to save for your future, it's possible because you don't have so many. You know, we cannot use the same method to address our financial challenges. So I must use what works for me because I know my financial status and my condition. But the thing is, what brings us together into wanting to address our financial problems is where do I want to get to into the future, and what do I want in life, and how do I get there?
And then there's people that have just started working. They have no furniture, they have nothing at all, but they want to own these things. They want to rent a flat, they want to buy a TV, their bed. What would you advise them to do? Do they go into debt, buy these things, or save before and then buy?
It depends. You may buy these things. I may buy a bed. A TV is not actually a need, it's a want. I can buy my bed and I know I want a TV. While I'm buying my bed, maybe I bought it through a debt or cash, it's okay. But I cannot buy all of these things at the same time. What is it that I need the most currently? A bed, of course, you need, and maybe a fridge. Then work towards having those things that identify what do I need and I cannot live without. And they buy according to that order.
So a higher purchase is ideal.
They are not. They are not because they are very expensive at the end of the day. You find that you pay 2 times or 3 times what you would have paid for if you had disciplined yourself to say, I want to save towards achieving this goal. You can't go for a higher purchase if you saved and then you are able to put in a lot of deposit so such that the installment is not too high for you. Then maybe you can go for that so that your interest will be still too low. But to start with a high purchase with less deposit, then you're just killing yourself. Because when you calculate at the end of the day, you would have actually what you would have paid for that bed that you bought through an installment, you would have saved that money for far much better things for you in the future.
All right. Lastly, Prudence, words of advice to consumers. I think what I took from our conversation is definitely if you want to get out of debt, you need to change your lifestyle, differentiate between wants and needs, and also be determined that you want to save money. What last words can you say to consumers?
To consumers at home, I want to say there's nothing that is impossible. It's doable, but just tell yourself that I want to come out of this. And please, 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 just plan for your money. Know what we are saving for and stick to that. And don't allow the other noises, because there are too many noises that derails us and distracts us from achieving our financial goals. So we just need to forget about those noises and focus towards the goals that we've set for ourselves.
All right. Thank you so much for your time, Prudence. Well, there you have it. Bugeli, it's still possible for those that want to start saving now from July until December this year. They can still save, but do get a financial advisor to give you more advice on how to save, how to plan, how to budget, and how to invest your money. After the break, we connect with Nomzamo Dlamini from the Deputy Prime Minister's office. Stay with us.
nobeleka bekunalomnye sisi nje satholana lesibhedlela singadani ukuthi sibelekele umuntu munye.
Ngingasho ukuthi umntwana ngiyamehluleka ngimoya. Sathi ngathi umlahla.
Mina bengiphila impilo yokuhlala ngigijima ngaso sonke isikhathi ngekuba bede badala. Ngakumba nami ngitolala naye emapayipini uNkulunkulu tosisiza.
Akabuyele emuva kakhulu ngemaciniso. Asuyanyaza tena. Angithethi. Into wathi ngimdala. Akasudlala lo mntwana ngakho.
Eswatini TV has signed a code of conduct that is enforced by the Eswatini Communications Commission. We are committed to reporting news that is accurate, comment that is fair, and programming that does not amount to hate speech or the description of gratuitous violence or explicit sex. For any complaints of our programming, please contact us on 2411-9600 or email info@eswatinitv.co.za. You can also contact the Eswatini Communications Commission on 2406-7000 or write a letter to ECCOM on PO Box 7811 Mbabane. Email address is info@ecom.org.za.
Kude lesinye isikhathi ngaphandle kwalesi.
Aba research bafunze.
Being risky means ukuthi nalokuwa kwayo kulula.
Nathi kufuna senze ukukhiqiza lokusemndeni.
Asimze sinamukele sabonga hlala nathi lamhla ekseni sichubeka nalo luhlelo datheke ngensimbi yesiphohlongo lomhla ebusuku umsakazo Eswatini TV udaba udlala episode yekuqala ngqa yeluhlelo lelubutanga ukuthi asibambaneni sibe ngumndeni hlelo ke lolu luqhutshwa ngilihhovisi leliphina ndvunankulu libambisene nawo umsakade gender coordinator ehhovisini la DPM nomzamo Dlamini sesinaye via Zoom. Dosichazela nje kabanti ngalelo hlelo nokuthi ngabe yini kahle kahle mhlambe lesingayigatha throughout the season. A very good morning Nkosi. Siyabonga ukuthi benathi lomhla ekseni. We are excited ukuthi lo muhla siyaqala kubona hlelo episode 1 uyaqala kudlala walo hlelo. What can we anticipate ngalelo hlelo especially episode yekuqala nje lo muhla?
Asibonge kakhulu lokusinika lelithuba siphinde sivusele nakubabukeli emakhaya. Njengoba sivele sihle sivela nje nakunika tihlokanyana kancane ngalolu hlelo lethu. Elangeni la namuhla njengoba sowushide ukuthi HPM namuhla selivele liyaqala. Ngako nje sithi simema bona babukeli emakhaya ukuthi basonzela nebomabona kuthi babo lapho khona batobona kabanti kuleli hlelo. Kuleli hlelo Lulu ngingafuni mhlawumbe ukuthi ngithi preempt ema episodes ethu la kade udlala ngingasho nje kafishane kwekuthi lihlelo lethu leli ligcile kakhulu ekubuyiseni nekwakheni nekucinisa imindeni. Siyadi ukuthi sive sisahlalisene emakhaya kuye kube khona tinkinga ngaba khona kubatali nebamfana babo lasebakhulile. Tiba khona tinkinga kumtali nebamfana bakhe babancane. Tiba khona tinkinga kubomake nababe ekhaya ukhanzeke ukuthi lo munye loyo mhlawumbe lova ngathi akakaphatheki kahle noma akakajabuli noma yena akakhoni. Ukhanzeke ukuthi so uyahamba so uyabashiya labanye. Kanti lokho uyukhanzeke ukuthi nako ngilokunye lokwakha silonza. Ngabaze bamfaneni kungaba kuye umdali. Ngakho ke lihlelo lethu lumcoka ngekuthi umndeni ubuyisane uphilisane kahle ngekuthula kube nelithandvo kube nekujabulelana ikakhulu nje nabamfana bakhule endzaweni bakhule ekhaya lapho kunelithandvo lebatali babo khona. batali sikhuluma ngama-ke ngababe bamfana bayalifuna lithandvo lebatali babo bobabili. So kafishane njena Lulu ngingasho ukuthi babukeli ngiko konke lokho labatakubona ngekuhlukana kweticephu lapho khona sitawuveta nakabandi nje ukuthi lokunye kuba yini beve labamfu labaphatheka kuleli hlelo batikhulumela ukuthi make bengiloyo wahamba asho ukuthi mina ngahamba ngahanjiswa ngilokhu nalokhu nalokhu asho ke nalo mhlambe lo selengemuva sinqumo sakho ukuthi usishiya lendlela kusibangele naku ngilawo ma dynamics lawo nje lesizama kuwaveta phinze luhlelo lolu alugcini lolu ngeke ukuthi luvete letindzaba tebantfu kube kuphela kuba khona lapho vele ukhanze khona ukuthi kunelisito lolunye lolungetekile bese bashoda ngalo noma lo ukhanze ukuthi bayalidzinga kulapho ke nele office liphinze nakhona lelu lesandla kuvala le topical la letikhanzakele kulowo mndeni.
Kafishane nje 1 minute nomzamo engabe vele nisashutha lo hlelo nikhonile ukuthi ni fulfill purpose yalo lo hlelo imindeni ikhonile ukuthi ibumbane ihlangane. Just 1 minute.
Kusijabulisa kakhulu Lulu kusho ukuthi leminingi vele imindeni ibuyisene ikakhulu njena lebesi ukhanza vele ukuthi bomake bahamba bashiya abamfana noma ngibabe wahamba washiya likhaya but ukhanze ukuthi ngekuhlalisana nekucocisana babhobokelane ukhanze ukuthi cha sebayabuya bayahlalisana ngekuthula noma umfana lomunye lobeka ngadiwa la ekhaya so uyalethwa uyahlanganiswa nemndeni wakubo bamjabulele bamemukele ngiloko makakula.
Alright, nosibonga kakhulu ke vakala Nkosi. Mbukeli nguye nomzamo Dlamini Gender Coordinator ehovisini leliphini nanvunankulu asivitela nje sithombe kafishana ukuthi ya luhlelo taba mnanzi impela nokuthi bakhonile ukufeza lokho labe bakufisile emhlozana baqala lolu hlelo ukuthi imindeni ibumbane ihlangane njengoba ibitola lo hlelo libitwa ngokuthi asibambaneni sibe ngumndeni. Ladlala ke lo muhla ngensimbi esiphohlongo ebusuku khona la emsakadweni Eswatini TV. Saselkevu sabuya sitovala hlelo.
Nangiyobeleka bekunalo mnyesi nje satholana lesibhedlela singadani ukuthi sibelekele umuntu.
Ngingasho ukuthi umntwana ngiyamehlika ngomuzi. Sathi ngathi umlahle.
Mina bengiphila impilo yokuhlala ngigijima ngaso sonke isikhathi ngekubabede batala. Ngakumba nami ngitolala naye emaphayiphini uNkulunkulu tosisiza.
Akabuyele emuva kakhulu ngemaciniso. Asuyanyaza tena. Angithethi. Into wathi ngimdala. Akasudlala lo mntwana ngakho.
Bona lomuhle ngo 3 minutes before 8 o'clock sesifika emaphetheleni alo hlelo lomuhla ke phakethe indzaba etimnanzi ukuthi luhlelo lakho asibambaneni sibe ngumndeni laqala lamuhla. We actually cannot wait nathi kulibona ukuthi ngabe litohamba kanjani njengoba takumla ukuthi besolo siba nabo laba ka DPM basichazele basikade nje sithombe sekuthi vele simo sinjani lapha eveni asibona indzaba gender based violence lo hlelo lolu luhloswe kakhulu kubuyisa imindeni ukuthi ibumbane ihlangane ivane ngoba sitawati ukuthi kune batali labo ukhanze ukuthi sebalahla abantwana babashiya nabogogo nabomkhulu wonke lo mfalo loyo sowela etandleni tabogogo nabomkhulu lokuyinfo lihovisi liphina mvunankulu lingahambisana nayo. This program ke lihlose ukuthi vele libuyise yonke imindeni ihlangane ibumbane.
In exactly 12 hours 2 minutes lihlelo liyaqala njengoba nje lokho ubumbana insimbi esiphohlongo naloke mayibumbana nzambama luyangena sithemba ukuthi mosada dalu jabulela kakhulu. Siphathini benathi lihlelweni benelisuku lohlensale kahle.